Hi, everyone. This is Steve Ginrich with UT Dallas Office of Research, Associate Vice President for Innovation and Commercialization. It's great to have you here for the Lab to Launch program today. I want to talk about new fall 2021 programs in innovation, commercialization, and entrepreneurship real quick. First, as a reminder, our mission through all of these efforts, the programs, the resources, the funds that we make available, is to enable the next generation's new ventures. That's through the education, empowerment through funding and connections that we have, and then equipping you with the equipment and needs that you have. We're augmenting the programs that we've had for several years with 3 new programs this fall to help UT Dallas Ventures. The first of them is a seminar series we're piloting in our bioengineering area, bioengineering startup training, which we tend to extend to other STEM disciplines for research scientists and faculty at UT Dallas. The second one is the Venture Development Center Jetpack. You'll learn more about that by going to visit the VDC and watching the Jetpack video. And then there's UT Discovery. It's an award for undergraduate research students who are interested in learning about applying their research interests to real-world situations by working with a venture. So hope you can check into any of those programs or all of them and enjoy the Lab to Launch. Thanks.
Good afternoon and welcome to Lab to Launch, the virtual series for researchers interested in pursuing entrepreneurship. My name is Enrica Ziller, Research Education Programs and Outreach Manager in the Office of Research and Innovation at the University of Texas at Dallas. As we move through today's session, I invite you to post questions into the chat for our guest speakers to discuss. Here to guide today's conversation and introduce our guest speaker is our host, Marvin Young. Marvin is the Intellectual Property Manager of the UT Dallas Office of Technology Commercialization, OTC, and has been with the office since 2018. Marvin, the mic is yours.
Good morning. Let me just say a word before I introduce Dr. Tamil about what we do at OTC. So we have 3 primary things that we do. We first interfaced with our faculty and researchers to identify inventions and software that can be commercialized and can be translated from the research lab to a commercialization effort and ultimately to the public. So we identify those and then we work to protect them through a patent process. And then finally we work to license them to potential licensees. So we work pretty closely with those potential licensees to put together agreements that work for them and work for us both. So that's what we do at OTC. So without further ado, let me introduce our speaker for today, Dr. Tamil, who I've worked with and had a pleasure to work with as a part of the OTC. So Dr. Tamil is a professor in electrical and computer engineering at UT Dallas. He is a serial inventor. I see him pretty often here. And he's contributed to inventions including focused beam antenna, which is now finding an application in 5G, an all-optical container switch. Another example is an immersive telemedicine platform with cognitive support, automated cardiac arrhythmia monitor, automated mammogram analyzer, automated sleep apnea and sleep quality monitors. These are all examples of some things that he's done. A few examples. He holds 23 U.S. patents. He's the founder of Yada Networks and Hijatel and Corp. He's published 150 articles and 8 book chapters and directed 23 doctoral dissertations. Dr. Tamil is a fellow of the National Academy of Inventors, the Optical Society of America, and the Electromagnetics Academy, and an elected member of the International Radio Science Union Commission's B&D, and a senior member of the IEEE. He's also a member of the American Association for the Advancement of Science. Please welcome Dr. Tamil as he shares the story today of transforming a doctoral dissertation into a successful company, MedCognetics, for which the work has been supported by both UTD and UT Southwestern. Welcome, Dr. Tamil.
Good afternoon. Thank you very much, Dr. Marvin Young. It's always a pleasure working with you. Today, I have the privilege to share with you some of my experience of entrepreneurship while working at UTD. UTD is a great place. It's always, every day I wake up, I feel good about the institution, good about the people I work with. That gives me a lot of pleasure to be around UTD. It's very appropriate that I start my talk saying thank you to Hobson. Dr. Hobson Wildenthal has been a great force in UTD and in a lot of young faculty like me. Then I was young. When I met Dr. Hobson about 30 years ago, I was a very young assistant professor. And he was extremely nice, and he's a real entrepreneur in his bend. And he always encouraged people to take risk. I took a few years of leave of absence to go and start my first company. It's called Yata Networks. And Dr. Wildenthal was extremely supportive. And also, I owe him a lot of gratitude. When I returned back from Yata Networks, that was about 20 years ago, I found this company. Then when I returned back to UTD, I wanted to do something big and I wanted to do something very interesting. Then I looked around. I thought that AI on healthcare is a topic that of interest and of great value to the society. So I picked the topic and built a laboratory around this. I named it the Quality of Life Technology Laboratory. And I was extremely fortunate to have the collaboration of my great colleagues like Dr. Gopal Gupta, Dr. Mardat Nurani, Dr. Vincent Ng, Dr. Isa Panagi, and my statistician friend, Dr. Larry Amon, and above all, Dr. John McCracken of the management. I owe him a lot of gratitude, especially to Dr. John McCracken. He's such a fine gentleman, and he always helped me. Anytime I go to a problem, he has a way of finding help for me. So this is, we need to register certain things in life because life being not, infinity. So in this laboratory was started in 2005, and the vision was to improve the life of people through technological advancements, innovations, and commercialization. And as a part of these, we built a lot of technologies. I have listed the technologies that we have built, from telemedicine to AI for heart arrhythmia to sleep quality assessment, breast cancer detection, and earlier detection of asthma and COPD attack, and also management of heart failure. All of these were done. It's all not done exclusively by me, in collaboration with my students and my collaborators. At this time, we are also working on two interesting topics on oral cancer detection and personal health robot. So when we looked at all of these things, each one of these has its own history. The Presbyterian Hospital supported the development of this intelligent telemedicine, but their need was, when people come to the hospital for heart failure, they have to keep them at home after they return back at least for 30 days. Otherwise, the insurance company will charge the hospital. So we built a technology and we tried it out in Cleburne, Texas on 13 patients. It was a very successful clinical experiment. developing that into a commercial was a problem. This is another thing that we went through this. Before the COVID, telemedicine was in slow pace. Thanks to COVID, it has proved some of the technologies that were waiting to be proved. Now, telemedicine is an accepted technology. And in the last 2 years, millions of patients have been treated through telemedicine. With our telemedicine also an immersive platform, it's unlike the telemedicine that you see today. It's very simple. It's almost creating a doctor's office in your own home. And it is waiting to be commercialized. Then we built this heart failure management. Then this is a system that will help doctors to manage heart failure patients. This is a good learning that we had, that all we invent is not easy to commercialize. So what we did was, when we wanted, I did this with Professor Gopal Gupta, and the prime brain behind this is Professor Gopal Gupta on the heart failure management system. So the heart failure management, so we wanted to commercialize that first. So we were very fortunate enough to obtain a National Science Foundation proposal granted for the iCorps. It is a kind of a boot camp. And myself, Professor Gupta, and one of Dr. Gupta's postdoctoral student, Zuo Chen, along with Mr. Vijay Jain, is an external experienced entrepreneur and who was mentoring us. We all took a trip to Nashville, Tennessee for a boot camp of a week on learning the lean startup model. The interesting thing about this is, normally when we want to start a company, we get an idea, go and build a company. But then in order to reduce the failures, the lean startup model tells, look at the idea as a hypothesis. Mr. Vijay Jain is an external mentor, and he was extremely kind to us to spend a week with us while going through this boot camp. And as I told you before, the boot camp is about converting this idea into a hypothesis and testing this for market, testing this for product, testing this for pricing. So every idea is converted into a hypothesis. You build a product which has minimum viable, it's called a minimum viable product, MVP, and use this MVP to test out. And based on the test, you can pivot, or sometimes you may come to a conclusion, well, this is not for commercialization. That's what this lean startup model taught us. So we used our heart failure management as a topic to learn this model. And what we learn out of this model is, for example, our heart failure management idea is better for licensing than for starting that as a company and commercializing. So it gave us a result. I mean, this is a good model in the sense that when we tested this model, we came to the conclusion, no, this is not a candidate for commercialization, but definitely it is a candidate for licensing. So after learning this model, even though we didn't succeed in building a company around the heart failure management, we were cooking at, and the way that we built this model is going to various places, talking to the various archetypes. That's how you get the information about your product and what people like, what people do not like. That's one of the very important things that we learned in this boot camp. So while we were working on the heart failure management, we were also cooking up something in our laboratory, finding cancer, detecting breast cancer using artificial intelligence. So this was done by a couple team working with me. Tim Cogan, he was my doctoral student. He's still my doctoral student. He's about to graduate. And Miss Mary Beth Cogan, she was then a master's student. And we three of us built together a machine learning based algorithm for detecting breast cancer. The result was very good. And then it gave us an idea, maybe we should commercialize this. Then again, that what we learned at the NSF boot camp came to rescue. He said, well, it's good, we can commercialize this, but is it worth commercializing this? Is there a value to commercializing this? So what we did was we wanted to build a minimum viable product. And there came Christopher Simmons. He was extremely kind to work with me and my student to put this algorithm in the cloud. And when we put this in the cloud, we built this MVP. I have to say a word about what is meant by MVP. MVP, the minimum viable product, what it means is it is not the minimum feature product. You have enough features to test and get information about it. The information may be on the viability as a product, viability in the marketplace, or viability in revenue. It can be any one or all of these things. So we built this minimum viable product. And I can show you some of these things that this is a very nice thing that the student did. All you have to do is to go there and click on this. And again, how easy the viable product it should be is demonstrated here. Now, you wanted people to look at it and see for themselves how good is this product or how valuable it is to them. So we gave also an example that is very interesting because a lot of people didn't have the file in a format that we could use. So for them, we gave also a file. Then we let them analyze this. So this minimum viable product, people can go and access and test. I sent it around and I had an overwhelming response from potential customers. Hey, this is good. I couldn't believe that it detected cancer, that even our radiologist couldn't figure that out. So after I heard that, then I was convinced, yes, this can be a potential candidate for us to commercialize. And I could also see the archetypes that were interested in this. So then at that time, I invited an old friend of mine who supported my earlier venture to come and visit my laboratory. Richard Stubblefield is a veteran venture capitalist, and he's one of the very brilliant venture capitalists I have seen. He's not only a nice man, and he's also extremely brilliant. And he could figure out what works, what will not work. So I wanted his opinion, so I brought him to my laboratory, and he said, show me everything you have, not just the breast cancer. So I showed the whole laboratory experiments and the laboratory projects, all of them. And then he was attracted to this breast cancer. And the reason was, he told me that this has a high potential for success. And also he told me that now when we want to provide a good healthcare for 7.3 billion people around the world, you cannot ignore AI in healthcare. AI is very important. Artificial intelligence is one of the ways that we can provide a quality healthcare to the large number of people around the globe. So then he was interested and he put some money into this. And also his brother was there, a good man, Greg Stubblefield. Unfortunately, he's no more, but he was also ready to put up some money, and they put this initial seed to commercialize this product. And then I went to UTD, and I'm again very lucky to have Joseph Pancrazio as vice president and Brent Schultz as the senior director of commercialization. They were extremely supportive of this idea, and Brent worked with me very diligently in getting the company off the ground. So I owe them a big thank you. And the interesting thing is that when I first started the first company, there was no infrastructure in place. As I told you before, I was lucky that Dr. Wildenthal helped me to do this. But then since then, there is an excellent infrastructure in place. And this keeps the professors also very honest. We don't have to do anything behind the back of the university to start a company. And so I'm very grateful for the team, the whole Office of Technology Transfer Dean, current and also in the past, who have worked on this. So then, after starting the company, the first thing is to put together a team. The team is the most important. And one has to be also lucky to come across good, talented people. One I am. I'm always lucky with people. And I found excellent team. Ron was at TI. He was a director at TI. Then later he joined Devidia, that is a healthcare company. And from there he came to MedCognetics. That is the name of the company that we have currently. And then we needed a good CMO. CMO is important because it is a healthcare company. And we could hire Dr. Pala Gupta. My doctoral student who built the algorithm, he became the head of the AI machine learning department. And in any company, quality is very important, and it is more so in a healthcare company because the quality is paramount when it comes to FDA submissions and approval. So John Jenkins, who is excellent, the quality manager, is a very senior person, and he's leading this quality in MedCognetics. And we have another very talented young fellow, Chris Beatty, and he's the VP of operations. So we were able to build a good team. And if anyone wants to start a company, if they ask me for any advice, my first advice is please take your time to build a good team. Your rise and fall mostly depends on the team. Okay. Then came the other challenge. In order to do a machine learning algorithm, for the paper, we could always find a publicly available data set and we can prove the concept, but that's alone is not sufficient to build up a viable product. Now, one of the greatest challenge in machine learning is finding the large amount of data, not just the data, the high quality data and a well curated data to build the product. And another important thing is that when we built the product with the data from India, Indian patients, it didn't work in Africa. When we built with the Indian and African patients, when we tested it in American patients, it didn't do well. So it's extremely important in machine learning that you remove the bias. In order to remove the bias, you need data from all sections of the society. And we were very fortunate to find good source of data in the United States. And again, such data is very important for FDA. FDA, they like you providing your statistics on the American patients. So you need to have, in addition to American data, data from all over the world. And another biggest problem you will face in building a machine learning algorithm is the algorithm is a black box. You don't know how things work. And doing an explanation is very important. You have to come up with an explainable algorithm. That's one of the key to success of such a product. And we were able to build relationships all around the world. As you would see, that we have built from Asia to Africa to South America, and of course, in North America, we were able to build collaborators who could work with us, both providing data, testing our product. And so that's one of the good things we were able to do in the last 18 months. And then when we are ready, we are almost ready for FDA. And one of the key things that we need to pay attention to is the quality of the data. And testing this, we are talking about hundreds of thousands of samples, and assuring the quality of every one of this is not an easy task. And then we built the algorithm. Now we have to verify the algorithm for its correctness. That is very important. Then we have to provide the validation. And the validation results, it has to come mostly from American patients. That's one of the requirements of FDA. And then again, in order to generalize the product, we have to address all the bias. The bias not only comes from the ethnic groups, but also comes from machine variations. All of these things has to be addressed. And finally, as I said before, the interpretability of your algorithm. And we are diligently worked on most of this, and we will be soon deploying the product and also submitting to FDA for their clearance. Now, what we are really building? We are really building a platform, and we use this breast cancer as our first test case. After we successfully deploy this, then our strategy is to go through the list of areas that we have figured out. And we have an excellent partnership with UT Southwestern and UTD. And together, we will be steadfastly attacking one after another to create a platform that can be very valuable to radiologists. And that is this company that we are working towards building. Now I am ready to talk to you, and thank you very much for listening to this conversation.
Okay. So I think we've got, let me pull up some questions here for you, Dr. Tamil. So first question, what factors should someone consider when weighing creating a startup versus licensing a technology to an existing company? When is creating a startup the right path?
Okay, that's a good question. I can invoke our experiment with the heart failure management algorithm. You have to test it out and see that what are the archetypes who would subscribe to your product, who would buy your product. How big is the market potential? Will it survive as a standalone company with this single product? Those are the things you need to assess when you look at the market and also the competition. That's also extremely important. When you weigh all these things, you will come to a conclusion, hey, this may not be a product that we should go and start a company with. But definitely it can be a product that you can license. But in the process also you will figure out that who are all the potential licensees. Okay.
Yeah, so I'll follow up with kind of a question of my own related to that. So it's maybe a little bit more personal. So what motivated you to create this particular startup, and what advice would you give to a UTD faculty member or researcher who's considering being a CEO of their own startup and taking that path?
Well, my first
It's two questions there, I guess.
My immediate answer is, if you can avoid being the CEO, don't be. First, you have to test yourself. Are you a CEO material? The word CEO looks good, but a lot of us are good researchers, but may not be good CEOs. Second thing, it takes a lot of work. You should be concentrating only on one thing. You don't have the bandwidth to do research, to handle your graduate students, to teach, and then also to become a CEO. Maybe you can be a CEO until you find a CEO. Okay, that's my, whatever it's worth, that's my advice to my colleagues.
So here's another question. What are some of the biggest challenges that you faced on your commercialization path with MedCognetics in particular? And how did you address them?
Well, I think that like in any company, the biggest challenge is finding the right team. Because if you want the best people, why they will come to you? And you have little money, and they also know that, and then they have other options. But attracting the best people, that's where you have to work on. You have to offer them more than just the salary.
May I ask?
for people with that kind of an entrepreneurial mindset. That's the challenge one. The challenge two is, where do you find the money? Finding investment is the second challenge. And then finding partners to work with, that is another challenge. So building a company is a series of challenges. And every day you have to put out some fire. That's why I said that if you are a CEO and also a faculty, it's going to be very difficult.
So how long, kind of dig into this a little bit, how long did it take you to put together your team? And in what order did you do this? Were you seeking money first, or, talk to us a little bit about how you built your team versus how you began to raise money.
Oh, it is a egg and chicken problem, because if you don't have money, nobody will join your company. And if nobody is there in the company, people will not give money. Right. So this is where that you have to push and pull. You have to, sometimes you create a meeting with the potential employees and potential investors. Then each see each other. Hey, this guy might fund the company. Hey, this guy might join the company. See, those are the tactics you have to build. The first few employees and the first few investors are difficult to combine. But once that happens, then people see a company structure, a few employees, and there is some money in the bank. Then they will be more comfortable to invest, and also employees will be more comfortable to join.
How long did it take you from the inception of MedCognetics, from the time you made a decision to spin out a startup, until you had you feel like you had your team together?
I said I was very fortunate. I could do it in 6 months.
Wow.
Yeah, that's a little fortunate, because Rick is a seasoned veteran venture capitalist. But as soon as he saw this, he said, yes, here is the check. And then, I took some of the potential employees for a dinner with him so that both could see.
Okay.
That's how we were able to make it.
Yeah, I think you were very, very fortunate.
Yes.
Which I think speaks to the power of having a good mentor. So I'd like for you to talk a little bit more about that. So he helped you put together your team. Talk to us about how to find a good mentor and how you found your mentor.
Okay, I'll tell you the trick to finding a good mentor. There's only one trick. If you want to own the whole company, if you want to be the only popular guy in the company, you will find no mentor. Yeah. This is what I found. Because if the whole company you want it to be yours, yes, you can keep it. But the company is a separate entity, and you are one of the multiple people who will be related to the company. Once you have that attitude, everybody is willing to help you.
Here's another question. I've still got another one in my head, but I'm going to ask this one. What is your long-term vision for MedCognetics?
The long-term vision is to build it out as a platform where we do multiple of these, disease conditions. And that is we wanted this to be one of the excellent product in the market, that it can do multiple disease conditions.
Okay. The question I had was, tell us a little story about, or talk to me about what's been the most fun about this. You know, either IATA or Hijatel or MedCognetics. Some fun moments, or just the experience. What have you found to be fun?
That's a good question. Actually, you know, I cannot imagine not being an entrepreneur now, because every day it is a problem, but it's also every day it is a fun. Every day you get something solved. Every day, you know, when you find a potential customer, wow. And every day that something doesn't work, then you sit down and see that how you can resolve this. I mean, that is an experience that I haven't seen in my other profession, that is as a teacher or as a faculty, because most of the answers I had there.
Mm-hmm.
And also you can tell the student to do, and he will obey and do the work, but you cannot do that with the employees. How do you coax them? How do you win their respect? I mean,
Right.
that is very, very important. Why they have to work hard? I mean, you have to create, you have to give a reason why they should work hard. That's another thing, again, going back. They should not perceive that this is your company. They have to perceive that this is their company. That I found once I do that, it's not much difficult to do it.
Okay, here's another question that's come in. With the emphasis that's placed on building your trusted team, it sounds like networking would be an important step in preparing to start a company. Could you provide some advice on how best to network?
Well, that is one thing that I never figured out how to do networking. Mostly I went through friend circles and people I know in the past. But that may not be, you know, the right route for people who are starting out. When you're young and you are starting out, there should be a formal way of networking. And my answer is I do not know. But definitely there is a networking way, and I'm sure Dallas should provide this, but in Silicon Valley, they have these opportunities. But maybe that, you know, I don't know whether we have such a thing in Dallas. If not, maybe we should spearhead that to connect people together. That's a very important thing. Dr. Young, you asked this question. Please, if UTD can do something to bring entrepreneurs and investors and other people together in some forum, that will be very valuable to the young entrepreneurs.
Yeah, I think Steve G addressed that at the very beginning. Some of the things that we're doing, you know, I'll speak for just a moment on that. You know, one is when you do decide to set up a startup company, we have the Venture Development Center where you have other startup companies who are struggling with the same, you know, questions and the same issues that you've described here, and it's sometimes adjacent fields, and so you can network through them to begin with, and they're connected to various investor groups. And then we have the Institute for Entrepreneurship through Capital Factory and through other avenues that you can approach through the OTC and through Steve's organization that I think we can help. There's the venture mentoring group as well that'll help you find mentors. I think that's a great place to start. Usually when we have a faculty member that's you know, considering a startup company, we'll have them get in contact with the venture mentoring group to kind of help them get started maybe begin to network and get some advice on how to network. So those are some things. I think you said it during the middle of your conversation that I think we've made some great progress in the OTC and in the Office of Research and Innovation.
Excellent. Yes. Yes.
What
I meant was here, in addition to bringing all already existing companies together and make them talk, that's important. But we need, the people from outside of the VDC, like, potential investors, potential CEOs, and those are the connections that we need.
Yeah, like Capital Factory. I think Capital Factory is an example of that, but that's,
okay.
There are other ways as well through, again, that we can access through the venture mentoring service. There are other ways. Those are some that I'm aware of that we're practicing right now.
Okay, excellent.
But that's good. It's an excellent point. Networking is crucial. So that was a great question. I think I'll try to finish with maybe one more question. Knowing what you know now, what would you do differently?
What do I do differently? Well, I would have taken time to understand the FDA process, particularly the statistics. I should have had a statistician with me early on. That would have helped to save some time. And also I should see, I'm opening up now. One of the problem of being a professor is you tend to think sometimes that you know everything. That can be a problem. When it comes to quality, I assume that, this is good, that is good. I do not know.
Very good.
Okay. What the quality manager told me early on, if I have implemented, I would have saved 3 months. But quickly we realized, hey, we should do that. But those are the things. So willing to listen is very important.
Very good. Well, those are all the questions that I have. Those are great comments, Dr. Tamil. Do you have any other final words for us before we close up today?
Well, I wish any new entrepreneur coming out of UTD the best of luck. And if there is anything I can help them, I'm always here to help them.
Very good. I'll turn it back over to you, Enrica. Thank you, Dr. Tamil.
Indeed. Thank you, Dr. Tamil, for sharing your time and giving us some unique insight with all of your examples and your experience. And audience, thank you for joining us today. And to view a full list of Office of Research and Innovation events coming up, please visit utd.link/research calendar. Thank you and have a great afternoon, everyone.
Welcome to the UT Dallas Venture Development Center. Innovation starts here. The Office of Research and Innovation designed the VDC in 2011 as an incubator to assist students, faculty, staff, and alumni to commercialize their ideas and inventions. This is done through targeted one-to-one support, enabling ventures to identify and build relationships with key industry partners, investors, entrepreneurs, and others to help them succeed. The VDC offers 20,000 square feet of dedicated office, lab, and meeting space, as well as shared business services and equipment. We help companies build out their teams, protect their intellectual property, and connect with expert advisors. We work to get minimum viable products into customers' hands and prove a viable, scalable business model. For startups, we help founders identify investor options, write and rehearse their company pitch, and navigate funding terms and other questions. For researchers and inventors seeking industry connections for translational research and licensing, We help identify partners, make introductions, and identify commercialization paths, including licensing agreements, IP assignments, and other contracting alternatives. The VDC, in coordination with the Institute of Innovation and Entrepreneurship, the Blackstone Launchpad, and the Office of Research and Innovation, offers VDC members the opportunity to participate in mentor networks, a variety of training programs, networking events, and student intern programs. Our other amenities include 6 large conference rooms, 24/7 key card access to additional lab equipment and instruments through our core program, telecommunications with high-speed internet and Wi-Fi access, printer, scanner, copier access, lunchroom with unlimited coffee, teas, and filtered water. We also have additional educational opportunities available. To become a member, companies complete a simple application and are interviewed by our innovation team. Membership is on a month-to-month basis and can be canceled with 30 days notice. For more information, please visit our website, venture.utdallas.edu.